Hello, everyone, and thank you so much for joining me here on Daily Spark TV. You guys know who I am. I'm Dr. Angela Butts Chester, and you know what I like to do on my show. Say it with me. I want to enlighten, inspire, and empower you to become your best self. Now, Scripture reminds us that the tongue is a small thing that makes grand speeches, but a tiny spark can set a great forest on a fire. And that's what we want to do today. We want to get you fired up about my guest. I'll be spending time today with Dr. Egilius L.H. Spierings, MD and PhD. And we'll be talking about his book, Headaches, Why You Have Them, What You Can Do About Them. I know, great title. So you know what I'm going to tell you to do? Go on, get comfy, get cozy, get your coffee or get your tea. Because we are about to get started. Hello, hello. Thank you so much for joining me here on Daily Spark TV. Welcome to the show.
My pleasure. Thank you so much for having me.
Absolutely, absolutely. Now, I know that this is such an important topic, and I cannot wait to talk to you more about it. But before we get started, we do have a little bit of a tradition here. We give every guest an opportunity to introduce themselves, if you will. We know that there's someone watching who's unfamiliar with you and your work. So first question is, can you tell us a little bit about yourself? What makes you, you?
Yes, my name is Egilius Spierings. I'm originally from the Netherlands, but I've lived in the United States for almost 40 years now, since 1986. In fact, I'm a neurologist, and within neurology, my specialty is headache and face pain. A subspecialty really within neurology that I've dedicated my entire professional life to, which is now almost half a century.
Oh, wow. That is such a wonderful answer. Thank you. Thank you for that. And I say that because you are telling us that you're going to give us some in-depth information, not just stuff that we can, Google or visit those medical websites to find out about, but some real practical information as well. Thank you. Now, being an author, is that something that you've always wanted to do, or did you find that this was one of the best ways to share your information with the masses?
I have really never wanted to be an author. In fact, I remember way back when I was a PhD student in pharmacology, it took me a whole evening to write one page. In those days, we only had regular typewriters and whiteout, and at the end of the day, the paper it would stand up straight on the table because it was so thick with whiteout. So no, nevertheless, I have written about a dozen books, but pretty much all of them, except the one that you mentioned, my last one, Headaches, Why You Have Them, What You Can Do About Them, all written for the medical profession. So I don't know what's driving me to do that, something that I really never thought I could do in my life. But I think I felt compelled sharing my information with my colleagues. And with my book, Headaches, Why You Have Them, What You Can Do About Them, I really felt I wanted to share my knowledge and experience with the people who are afflicted by headache or face pain. There are many people out there who suffer tremendously. I've seen thousands of them in my practice, and we have really gained a lot of progress, or made a lot of progress, I should say, with regard to development of medications. And I want people to know what is out there, what they can potentially use, what they should ask for maybe when they go and see the doctors, how they should apply those treatments, those medications, and also, very importantly, what they should expect from the treatments, because that is generally something that is kind of an open issue. Physicians also very often will start a treatment of a migraine condition, for example, and have no idea what the ultimate end goal of that treatment is. And I can give you very clear answers to that as well, if you want me to.
Oh, I love that. Definitely, definitely. We're gonna get into that. Now, the title of your book, I love that it is self-explanatory. Myself, if I were walking along my local Barnes and Noble and I saw it, I would stop, pick it up, and thumb through it. I love it when the author gives you a very plain understanding of what you're going to read about. I love to read. I guess that's why I enjoy interviewing authors. With that being said, did you find that when you were in the writing process, did the title come to you first or did the title develop out of the writings? Did it come later on along the way?
So that's also an interesting question because, as I said, I've written a good number of medical textbooks, and I would always put an extensive outline together, do the necessary research, get the necessary references, and so on. But differently with this book, I really wanted to write just a book, although I don't consider myself an author, as I talked about previously. But I just wanted to write a book that people would pick up and read. And I think the title really was there on paper before I even realized that I was going to write a book. And also, what I didn't, it took me about a year to write the book. I wrote it at work, which I was able to do. Um, and I didn't tell anybody. I didn't even tell my wife because I didn't know whether I would be able to complete it. I didn't want people to start asking me, when is your book done? Blah, blah, blah. I definitely didn't want to contact a publisher because I've experienced with that in the past. They start harassing you, when is the book ready, and so on. And I didn't want to do that. I just wanted to write a book and took my time at work to do so. And, it was kind of an open question whether I would be able to finish it, but I did.
Yes. And that I kind of giggled a little bit because you're so right. When you're still in the process of doing it all, the moment you tell someone, it's almost as though they want to be your weekly accountability partner and they don't realize how long it takes to just get it just right, where you're ready to present it to the world. So I definitely understand there. Now, I usually ask this question of, is the book appropriate for someone as young as high school? But I want to ask a little differently this time. Would you say that your book is appropriate for someone who is experiencing the headaches? Is it appropriate for someone who isn't experiencing headaches? Does that matter? Some people just want to read for information's sake. Who is the target audience here?
So the primary target really is the patient with headache or face pain. But I also like to emphasize it's not a popular book. It has a lot of information in it that I think would also give a lot of insight into people who do not have headache, do not suffer from headaches or face pain, um, and including, you mentioned it, teenagers and adolescents. In my practice, I've seen a lot of teenagers and adolescents. They can suffer from headaches as much as older individuals do, and they very often don't get treated effectively. The reason being that they tend to see pediatricians. Pediatricians generally deal with, much smaller people, individuals, and tend not to understand or realize that teenagers and adolescents are like you and me, and they need adult size treatment, adult dosages, medications that we as adults use. And um, that is something that really breaks my heart when I see that. Also because of the fact that, for example, if you look at migraine, it's a chronic condition. Most people suffer from it for a good part of their life, if not their entire life. And I hate to see these youngsters, having to go through life like that. And I can fortunately say we have very good medications to treat even a condition, even a disabling condition like migraine, to treat the individual headaches, which I think is extremely important, but also to treat the condition long term and prevent headaches from occurring. we honestly have made a lot of progress over the last 30, 40 years. I have worked in that field extensively myself as a clinical trialist. And that's one of the reasons I wrote my book. I really wanted to share that information with people so they know what is out there and know what they should be expecting from the treatment.
Oh, I am so glad that you mentioned that our young adults, our teenagers are experiencing headache and face pain as well. I find that many times mom and dad are somewhat dismissive of, I have a headache. They think that they're just trying to stay home from school or they don't want to do a chore, and they don't give it as much attention as they should. And many times it's hard, you have a headache, okay, we'll make a doctor's appointment. Well, by the time you can get in to see that doctor, you don't have the headache anymore. And then the parents aren't sure if they want to take you. So I am so glad that you are hinting at them to pay attention to that, to make note of it, and to definitely draw attention to that and to mention it. Great, great, great point to make there.
What what is interesting here is also that, migraine is a genetically determined and inherited condition. It runs in families, and although, a parent, it's very often the mother may have migraine herself, parents do tend to dismiss it in their children, which kind of amazes me. They suffer themselves, but they don't see it in their children. And for their children, it's school phobia or they're too lazy to get up in the morning or something like that. It's really heartbreaking, to see that. So I'm glad you're paying attention to that. The young adults, I also like that better than teenagers and adolescents. Young adults, I like that phrase very much so.
Absolutely. We have to pay attention to them as well. Well, Doc, it is time to us to take a very short break. Now, before we go, of course, we know that your book is available on Amazon, Barnes and Noble, and wherever books are sold. But if someone wants to reach out to you, what is the best way to do that?
So my book has a website. It's called helpforheadache.com, and you can either put in the number four, or you spell it out FOR. Both ways will get you to the website. The website has a little video that I put together about myself and about the book. It also has a lot of reviews that I have received. About the book, and I'm very happy that I got all these reviews and they're presented there. And there are also links to purchase the book if you're interested to do so.
I love it. Alrighty, everyone. Now you know where you can get a copy of the book and how to visit. We'll be back right after this.
Hi, do you have something to share? Be a guest. Want to sponsor an episode? Visit drangela.chester.com. Thanks again for watching Daily Spark TV.
And we are back. Thank you for joining me for Daily Spark TV. Now, I want to ask you about headaches. We hear these various names as we go through life. People will say, I think I have a migraine, I have a headache, I have a cluster headache. What does all of that mean? Are there really and truly different types of headaches, or are we calling it different things just because we don't know what to say?
There are different types of headaches, and I would like to say that the two main types are really your ordinary or regular headache uh, that pretty much all of us experience every so often. I would like to say it's part of life, getting a headache every so often, which would be a regular headache. Some people call it a tension headache or a muscle contraction headache. It's very important to remember that these headaches are mild in intensity. They don't last longer than a couple of hours. Um, and you can easily treat them with rest relaxation or taking an over-the-counter pain medication. So that's probably, I mean, that's undoubtedly the most common type of headache that is out there. Um, from a clinical perspective, what is important are migraine headaches. And these are intense headaches. And migraine is really the single most common reason for people to have headaches that impact their ability to function, if not disable them, that come along with other symptoms like light, noise, smell sensitivity, nausea, and vomiting. These are the kind of headache that do not get relieved with some rest, relaxation, or taking an over-the-counter pain medication. Um, so I think these are really the two main types of headaches. And what I see a lot of is that people think they have just bad regular headaches or bad tension headaches or stress headaches, while in fact they have migraine. They continue to struggle with the over-the-counter medications. And, if you have headaches that, you can take a couple of aspirin for and they really don't go away, don't continue to do that, but seek medical consultation. Make sure that the person understands that you have migraine and there are specific migraine medications out there that are well tolerated, safe, and highly effective. And that's really what you should be relying on. So no over-the-counter migraine medications. The over-the-counter migraine medications are the same as the regular medications that come without the migraine label. That's extremely important. That's just a marketing gimmick. Don't go for that. Go and seek medical consultation. Make sure the doctor or healthcare practitioner understands you have migraine and that you need specific migraine medications specifically developed for this particular condition. There are also other headache conditions like cluster headache is one, and there are several others as well, but they're very rare, and I wouldn't really worry about that. I mean, if you have bad headaches, assume you have migraine and seek medical consultation because the treatments are out there for you.
That is such a nugget of wisdom. Thank you so much for that because that's going to be an aha moment for them. They're not understanding why they are taking these tablets or powders or whatever labeled migraine, and the migraine is not going away. The same way, like you said, when you have a regular headache and you take, a Tylenol or whatever, and woohoo, it's gone within, 30 minutes or so, and you're able to do that. So thank you for that nugget of wisdom. Now, I find that in speaking to just your friends and family that do experience headaches, many times they'll say something like, I get a headache after I eat a certain thing, I must be allergic. Or I find that when the weather changes, I get a headache, it must be something in the air. Are there really and truly common causes for headache? Are we able to pinpoint that?
Yeah, there are common triggers. I always like to say headaches come for a reason. They don't fall out of the blue sky. And that goes for regular headaches as well as migraine headaches. Um, but there's a lot of misunderstanding. For example, um, a lot of people get headaches from low barometric pressure when it's overcast. That has nothing to do with anything in the air or allergies or whatever. That has to do with the fact that your sinuses are not open to the extent that no sinus system can accommodate or can assimilate to that change in barometric pressure. That's put stress on the system, and um, any kind of stress, physical or mental stress, on the system can provoke headache. And if you're a migrainer, which is something that you have in you, that will then subsequently lead to a migraine headache. With regard to eating certain things, there's a tremendous focus on foods. And I always like to tell my patients, don't care so much about the foods that you eat, but make sure that you eat regularly, 3 times a day. Going without food is certainly as common a trigger of headaches, including migraine headaches, as, for example, stress. Where people talk about stress, I like to talk about fatigue, not stress. Um, First of all, stress is only one of the many triggers of headaches, including migraine headaches, but I think fatigue is really the biological trigger of headaches. If you ask me the question, why do we even have headaches? Why is there such a thing as headache? I would like to say we have headaches because it ties into fatigue. When we feel tired and we don't pay attention to our body, that means take a break, slow down our activities. If we push through that fatigue, Headache is the second symptom that will occur. And again, when you're a migrainer, which is in your genes, that headache is not going to be an ordinary or regular headache, but it's going to be a migraine headache.
Oh, wow. And you have touched on a little bit of my next question. I want to give you an opportunity to expound if you would like. And that is, how does migraine manifest? I'm hearing it's not always stress, but it's fatigue. It's not just that you're tired, but perhaps you need to eat, that you need to do certain things to help.
Yes.
Are there any other things that we can try to do to make sure that that migraine does not manifest?
Yes. So, first of all, what is migraine? How does it manifest itself? Migraine is basically a chronic condition. People have it over years, if not decades, of recurring intense headaches. If you fall into that category, if this is something that you recognize as, assume that you have migraine, and as I said earlier, repeatedly seek medical attention and get the proper treatment for that. Yes, there are many things I think that we can do to prevent headaches, including migraine headaches. For example, as I mentioned earlier, make sure that you eat regularly during the day. Don't go without food too long. There's a tremendous focus on hydration, but dehydration is not a trigger of headaches. So that is really kind of a myth here that is out there. I see people walking around with bottles, water bottles. That certainly is not something that really is relevant to headache. And I think people get confused with the fact that they haven't eaten for a little bit of time and they think they haven't had enough water intake. Um, Certainly, for example, exertion can trigger migraine, and especially in a hot and humid environment. And so that's where water intake can help because it helps you cool down the system, and that certainly can be beneficial. But I think also very importantly, again, in relation to fatigue as a trigger of headache, including migraine, is to make sure you get enough sleep. I'm a firm believer that people need 8 or 9 hours of sleep to be able to function um, to the best abilities during the day. But it's also important that you do that in a regular schedule. Go to bed if possible, always at around the same time. Get up, if possible, always at approximately the same time. Don't oversleep in the morning when you're a migrainer, because that can also trigger migraine headaches. When you have headaches very frequently, daily, almost daily, people have a lot of tension in the neck, shoulder, upper back muscles. Pay attention to that. I tell people use a heating pad daily on the neck, shoulder, upper back muscles, if possible, twice a day for about 15 to 20 minutes. I prefer a microwavable heating pad over an electric one because that gives you moist heat. But treat that muscle tightness with daily application of heat. And if you do that, you may well see that not only will the muscles relax over time, but also the frequency of your headaches may well go down.
I love the information that you are giving us, doctor. It is really helping. What is considered face pain and how do we know we're experiencing it?
Yes. So first of all, face pain is not a topic that gets a lot of attention, and that is both in the media as well as in medicine in general. Doctors generally know very little about face pain, and it doesn't really matter what kind of doctor you see or specialist that you see, whether it's a neurologist, an ophthalmologist, a ear, nose, and throat physician. It doesn't really matter. They all tend to know relatively little, if anything, about face pain. Um, the best known face pain, certainly within medicine, but I think in general, is what is called trigeminal neuralgia, which is a very severe type of face pain where you have this jabbing pain in the face. But that is a very, very rare condition that really only affects older individuals like myself, people over the age of 60 or 65. And I like to emphasize that because I sometimes see it diagnosed in relatively young people, like in their 30s, 40s, um, and it is overdiagnosed as well as treated. The treatment consists of brain surgery, so it's not just a small thing. So I think it's very important to remember that it's a very rare condition that gets overdiagnosed and overtreated. The most common cause of face pain, I would say, is what is called temporomandibular disorder, or TMD, where a person has pain in a jaw or in both jaws. It's generally not a tremendously intense pain unless it's on one side only. Um, a lot of people go and see a dentist for that, and I do not really know why that is because it should really also, and it can be treated by physicians as well, but physicians tend to know nothing about it also because of the fact that face pain in general is an ignored topic even within medicine. If you have pain centrally in the face, people very often, if it's on both sides, people look at it as sinus headache, which is really sinus face pain. Um, is the result of generally chronic inflammation of the lining of the nose and sinuses and clogged sinuses so that the air gets absorbed out of it and gives you that drawing sensation centrally in the face. But you can also have very severe pain centrally in the face on one side only, which is in the nose side of the nose and in the cheek. I have seen that to be life-changing, that kind of pain, and that is due to what we call bony intranasal contact. Again, it's a topic that hardly anybody knows anything about, including ENT surgeons. Um, it's easy to, if you know about it, easy to recognize. You do a CT scan of the nose and sinuses to diagnose it, and it does require a relatively simple and straightforward surgical procedure. But it can be a cause of really life-changing face pain located on one side in the side of the nose going into the cheek.
Wow. I have learned so much from you today. I can only imagine sitting down, reading the book, the amount of information that I would gain from that as well, and being able to go back and reread and make notes and all of that. Thank you so much for spending some time with me here today. Now, again, of course, viewers, this book is available on Amazon, Barnes & Noble, and wherever books are sold. But Doc, if someone wants to reach out to you, what is the best way to do that?
Again, the same website, my book's website, helpforheadache.com, either a number four, or FOR spelled out. There is a contact button, and I encourage people to go to the website and write to me about their problems. I'll be more than happy to respond and see what I can do for people, as I've done also so far, because I've gotten some interesting reactions to my book. People have reached out to me, in particular about some very young adults with chronic headache, and I've already been able to help some of them. So certainly I would encourage people to do that.
Absolutely. Absolutely. I love it. Thank you again for being a guest today.
You're very welcome. Thank you so much.
And viewers, thank you for spending some time with us here today as well. You could have been anywhere. You chose to spend it with me today, and I thank you for doing so. I hope that we have once again enlightened, inspired, and empowered you. As always, may the Lord continue to shine his face upon you. May you receive his grace and his mercy in all that you do. Until next time, everyone, remember that you are blessed in the Lord. Have a great day, everyone. Bye-bye.